I'm looking at a cluster of islet cells, and this is to cure diabetes.
On such an important day on the healthcare calendar, the world and Professor Ariel Revel are zoning in on one thing.
Access to healthcare is the #1 factor for healthy life with diabetes.
Better access to quality diabetes education and healthcare is exactly the theme for this year's diabetes campaign. Global awareness of diabetes happens each year in November on the same day.
The first most important thing in diabetes is to diagnose it. The major, most important issue is the access to healthcare, and you need insulin available. In some parts of the world, it's very difficult or expensive.
Now, you might not know this, but over 463 million people are living with diabetes all over the world. Now, in 2019, diabetes caused 4.2 million deaths. It's projected that by 2045, up to 700 million adults will be diagnosed with the condition. It's also a leading cause of cardiovascular disease, blindness, kidney failure, and even leg amputation.
What we are talking about now is an artificial pancreas made of real human cells.
Professor Revel says he's working on a cure, not a treatment, using human cells that act exactly like the original human pancreas, but it's still in a pre-clinical phase pending a pre-investigational new drug application.
We are able in our company to produce those cells which originated from stem cells, and stem cells are cells that are derived from human embryos and can be taken to any cell in the body.
I was diagnosed when I was 9.5 years old, 6.5 years ago, and I'm 16 years old now. It would be a dream come true for not only me, for millions of other teenagers and people who have diabetes.
Cadibastem's product Islet RX is for the treatment of insulin-dependent diabetes. It aims to free patients from continuous monitoring of blood sugar levels and repeated insulin injections. Israel is classed as the #1 country in the world for highest leg amputations due to diabetes complications.
Maybe this is a sign that we need to be more in control of many populations that don't have enough awareness about treating their diabetes.
It's ultimately about keeping diabetes firmly in the public and political spotlight.